The government's fuzzy math on coronavirus seems contagious. ABC 15 first reported how Arizona was lumping together results for two very different kinds of COVID-19 tests, skewing case numbers. ABC 15 investigator Melissa Blasius reports several other states and even the CDC have been caught doing it too.
Two very different tests are used to monitor the coronavirus pandemic. The nasal swab diagnostic test, also called a PCR test, checks if you're sick and contagious now. The blood test, the antibody test, also called the serology test, checks whether you have previously been exposed and recovered, important separately, but they can send mixed signals if lumped together.
It's like mixing apples and oranges together.
It makes it difficult to ascertain the true spread of the virus.
This week, even the CDC updated its website, acknowledging it too was combining data from both kinds of tests to calculate percent positive cases nationwide. Several other states, including Virginia, Vermont, Texas, Florida, and Georgia, were also outed for lumping data together. It's unclear how many other states are doing the same.
So we need to get a common set of definitions and standards across the country so we have a national snapshot of truly where we are in the pandemic course, because there are lives that are at stake, our economies at stake if we don't get this right.
The ABC 15 investigators reported on Arizona's test data lumping in early May. Governor Doug Ducey using the new calculations on the same day he announced businesses could safely start reopening, combining test types in daily counts and percent positive cases.
The antibodies don't tell you who is currently infected. And so a lot of us in the media raised the alarm about this.
ABC 15 data guru Garrett Archer shows us how combining the tests overemphasizes a downward trajectory, an important factor on reopening. The purple line, percent positive for diagnostic tests. The gold line breaking off shows the new combined calculation starting in May. That's because the antibody tests yield much fewer positive results.
The consequences would suggest a lower percent positive rate, which is a criteria for reopening, than what may truly be what's seen on the ground in everyday life.
After being publicly criticized, 4 states reversed course, pledging to split out the data in the future. Arizona's coronavirus dashboard lumps the data together at the top of its website, later breaking out the total number of tests conducted for each type, as well as a percent positive. But we asked the state health department director, why doesn't her agency just provide the total number of positive cases for each type of test?
And I'll take the data question back to the team.
8 days later, we're still waiting for a response. I'm investigator Melissa Blasius, ABC 15 Arizona.